this is one day after the operation. Yesterday I had my first operation, and it was all actually really quite panicky. The reason it was a little bit panicky was because I'd had my surgeon was away overseas, and the plastic surgeon was here, but they had to try and coordinate everything, and I had the most wonderful surgeon. Her name's Caroline Baker, and I came in the morning. She saw that I was a little bit flustered, and she actually just made everything happen really, really fantastically, so quickly. All of a sudden I was racing over to St Vincent's Hospital, and I was being admitted so that I could actually not only have the first couple of lymph nodes out, but so that I could also have the nipple flap delay, and I'll have to get all the terminology right. I don't have it all down yet, but I'll make sure that I do. I'm sure I'll know it all very well by the time I'm finished all of this. And then I also was going to have the other side of my breast, the breast that wasn't affected by the cancer. That was going to be, the nipple was just going to be lifted. So I'm a size F. I'll need to tell you that just for along the way. So anyway, it ends up that I've had the operation, and sort of at the very, very last minute, something resonated with the way that Caroline had spoken to me in the morning, and she said, just make sure that if you're going to have reconstructive surgery and you're going to have this plastic surgery, just make sure you get exactly what you want, because this is such a heady ride that, being really honest, everything happens so quickly. It's almost like you're trying to catch up with yourself. It's almost like everybody else is telling you lots of information. People are absolutely beautiful and they come out of the woodwork to support you. But at the same time, it's almost surreal. It's almost like it's not really happening to you. It's like it's happening to somebody else. So you get caught up, and people explain things to you, and you say you understand, but honestly I'm not sure that I actually have grasped everything that everyone was saying, and so they'll have to say it to me again. And one thing that's been really lucky for me, and how I feel really blessed, is that I've had Robert with me, my husband, the whole time, who's come to every appointment, and who's come out of there, and I'll turn to him and I'll say, so what did they say, and what does that mean? And he will just carefully and quietly explain it to me 3 or 4 or 5 times again until I understand what's going on. And I think that's actually been a blessing, but it's also made me realise at the same time that I'm actually one of the lucky ones who actually has somebody to call upon, and to be by my side and hold my hand through this whole journey. And that makes me wonder about people who don't have, or women who don't have anyone by their side, and that must be so hard, because I'm a really strong, positive woman, and I have pretty much almost felt that I'm pretty invincible since I've been older. I own my own business. I'm a professional photographer. I'm pretty successful at it. I'm a mentor in the industry. I hold workshops. I've spoken all over the world. I just think I'm pretty invincible. I'm a mum of 6, a grandmother of 4, and I'm 50. And I feel I'm pretty invincible, and yet I've learnt that I'm not. And maybe that's probably a little bit more of a shock to me than I thought it was. So I guess, anyway, going back to it, that at the last minute where the operation was concerned, I was speaking to Hamish, who is my plastic surgeon, and again, I can't speak more highly of him. He's just absolutely fabulous. Nothing is a problem. Nothing is too much effort to explain. He really explained things as carefully and as thoroughly as he could to me. But at the last minute, I said to him, look, honestly, Hamish, just tell me straight out, yes or no, do you think I should reduce my breast a bit, because I think I've got it in the back of my head that I'm worried about the mastectomy. I was worried about, having the implant popped in and having the expander expand the breast that's had the mastectomy, and then how big I would have to expand that tissue to get it to a size F. And I said, look, I'm thinking that I'd like to be a D cup. And he said, if that's what you want, that's absolutely fine. And he said, no, I'll do it today. I'll organise it today. And it was kind of like, oh my God. So I was waiting on the operating, sort of where they do the operating waiting room. Each individual surgeon came to me, spoke to me, made sure I was okay, made sure I was doing all right. The nursing staff, the theatre staff, so many people came, the anaesthetist, all came, made sure that I was okay. And it just, every little step just kind of filled me with a little bit of confidence, which was really special. And I went in there feeling really kind of confident, and I did make the decision that I would go down to a D cup. And Hamish made it happen. He just asked all the staff to stay, even though it was only supposed to be a nipple lift, which would have taken a lot less time, I believe. He just had it all organised. He said, no problem. So I'm going to show you now what the result is and how it looks, because I want you to see how things are, and then I'm going to tell you how it felt. So here are my boobies, as you can see. I'm just going to lift this up. This is what they give you to wear afterwards, so that you can actually just feel comfortable. Now I'm going to lift up my top so I don't get too much of a shock. I'll just show you. Okay. So this is my normal breast, how it was, which is quite big, an F cup, and it is still swollen, obviously, from the operation at the moment. And this is the D cup and how this is going to sit. So this has had a reduction. So this is the breast that's having the mastectomy, and this is the breast that's having the reduction. So there you go. That's what it looks like up to this point. So I just thought I'd let you see that. Okay. So underneath this arm, I've also had 3 lymph nodes out, or 2 lymph nodes out, sorry, I beg your pardon. And having those lymph nodes out was going to just allow me to, allow Caroline to find out that whether they were clear or not, so that she could do either an auxiliary clearance later at the next operation, which means taking out all the lymph nodes, I believe. I think there's about 50 of them. Or I could just leave it at this, because there was no cancer in the lymph nodes, and she wasn't. You know, you're not sure until each thing happens. So that's where we're up to for the moment. I'm waiting for the biopsies to come back from the lymph nodes, these last 2 lymph nodes. We're hoping that everything's okay, and it could possibly be, but obviously something that I'm learning along this journey, and I think that I want to really share with you, is that you just have to take each day as it comes. You have to really just go with the flow. People ask you a million questions. They want to know answers really quickly, and they're caring for you. But the problem is you just don't know. The surgeons don't know. Nobody knows until they check each little piece of the operation, or until they check each little thing that gets done. They just don't know what it's going to show or what it's going to turn up. And they are very, very thorough. And that is something that I've learned, that the surgeons are really thorough, and that's actually really comforting. But you have to learn to wait and go with the flow with each section that happens. So, yeah. So that's where I'm up to at the moment, and we'll see how we go from here. How I'm feeling about the surgery, I'll just let you know. The day after the surgery, I thought it was going to be quite horrific, the pain, but actually it's not. I'm going to tell you that I've got a pain, and I've not got a high threshold to pain in any way, shape or form, but the pain's probably about a 3 out of 10. It's pretty good. I was quite amazed. I thought I was going to be really, it looks worse, I think, than it feels. So that's encouraging, just in case you want to know how something feels. The node thing didn't hurt, the lymph node. You know, it's sort of touch, and the same with the boobies, because because obviously they're swollen straight after the operation because they've been tortured. They're swollen, but it's more uncomfortable than it is painful. And I'm hoping that's because I had good surgeons, and all surgeons are good that work in this area. So there you go. So it's pretty good, and so I think that's something that you can take heart with. Okay.